Hello and welcome to a special segment we like to include in our events called Analyst Insights. My name is Adam Lowensteiner, Vice President of Lytham Partners, and today I'll be moderating a discussion on the healthcare IT sector and where we are in the cycle. Joining us for this discussion is Alan Klee, Managing Director and Senior Equity Research Analyst at Maxim Group. He comes with a wealth of knowledge in the healthcare IT space, and we're very excited to have him back for another one of these conversations. Hi, Alan, welcome.
Welcome. Thank you for the opportunity.
Sure. Our pleasure. Maybe to kick things off, can you tell us a little bit about what your industry coverage is and how healthcare IT fits into that coverage?
Sure. I cover technology, telecom, and media, known as TMT, and healthcare technology. Healthcare technology has been the vertical that I've been focused on building out. This is based on my own interest and my view that there is a large opportunity for growth. As a result, I'm continuing looking for new companies to cover in the attractive emerging growth and small cap area.
So, what is healthcare IT? How do you define it?
Within healthcare technology, I think about technologies that can help doctors and clinicians lower costs, raise revenues, improve patient experience, and improve health outcomes. So I also look for companies that are applying AI to healthcare. And I cover companies that do this in various areas, such as creating electronic health records from a patient-client visit, which can save doctors 2 to 3 hours of work a day and alleviate doctor burnout, and give them more time to focus on patient interaction and potentially seeing more patients. I also see companies that help doctors, clinics, and hospitals collect revenue and do it more efficiently and use technology to reduce administrative costs. One theme that some of the companies I cover and are in the space is how to identify risks earlier through either the use of AI or remote patient monitoring or chronic care management.
So, where are we in the cycle of healthcare IT? I mean, it seems like we're still in the early innings of leveraging technology in managing patients. Is that correct?
Yes, in my opinion. I believe we are in the early innings. Healthcare has been behind some other industry. They've been behind some other industries in the use of technology. Just think about how many times you have to fill out the same information if you go to the doctor. And the industry has lots of regulation and systems that often do not talk to each other well or are not well integrated. And also, there's a lot of medical records that are stored in an unstructured form. So it's hard to analyze to get the value out of that information. And so while there are a lot of technologies being implemented, we believe the key to making them grow in this early stage of the cycle is having capital, key partnerships, and key customers, which can, if you have the right technology, hopefully get you to commercial success.
I know you mentioned a few before. What are some of the areas within healthcare IT that are looking promising?
Well, definitely AI. There's great uses of AI in healthcare, and this is all pretty new. Applications for AI for companies that I cover include using the data you have to become like a co-pilot for the doctor so that you can suggest treatments. So you're not the doctor, but at least you can help them. And you can prepare charts so they can be better ready when they meet a patient, and create the electronic health record cheaper and faster. And using AI to structure the unstructured health records so that once you do that, you can help identify patients, for example, that might be at risk of various diseases earlier, rare diseases, or chronic diseases. AI can also be used to help identify patients that would be appropriate for a particular clinical trial. And clinical trials are typically very expensive to get the patients, and so that can help a lot. And then machine learning is starting to be used for things like scheduling and reducing wait times. I also believe that there's areas to improve transparency and reduce costs, which will always be an area of focus.
With an aging population, especially in the US, what applications are going to be most important for managing all these patients?
So I would highlight two areas at first: remote patient monitoring and chronic care management. So with these technologies, patients are monitored at home. It could be a device that's linked back to the doctor's office, and they do interactions during every month. And what happens is by doing it this way, you can catch early, if there's an outlier event. And this can be used to provide earlier detection of issues and create better health outcomes, and importantly, reduce costs of like emergency room visits and doctor visits where they're going once the serious event has already happened. In addition, what's attractive about these technologies is the reimbursement is there for doctors and hospitals. So we think that there's also some interesting technologies out there for elderly, that's fall detection that has more advanced services that are added to it.
Are there additional investing catalysts or tailwinds behind the healthcare IT sector, and what are they?
So I think it's kind of a continued pressure to lower healthcare costs, improve healthcare outcomes, improve the patient experience, and reduce burdens on doctors, nurses, and administrators. That those are going to continue to be key catalysts and drivers for adding new technology solutions. And also just all the new uses of AI that are being created. We also believe that greater transparency will be very important as a catalyst to help with costs. And we would note that just think about Mark Cuban and his cost plus drugs offering as a good example of how adding transparency can simplify things and lower drug costs.
Maybe another way to ask the question is, are there any up and coming technologies that are still in the early stages, in your opinion, that investors should be focused in on right now?
So like areas that we are watching closely include the remote patient management and chronic care management. In addition, a big area that we have several companies looking at is taking the unstructured medical records and structuring them with AI so that you can use the results to help identify patients at risk of rare and chronic diseases early, and also to be able to find the right patients to include in clinical trials, and then technology to use AI to assist and improve the diagnosis, of diseases such as heart risk and neurological conditions, where you're using the more traditional technologies, but you're adding the AI to it. And then telehealth solutions to expand the reach of healthcare. We also believe that applying AI and machine learning to data from legacy type testing can get improved results versus considering some new technologies that have come out of machine learning applied to EKG data for heart disease and EEG data for neurological conditions.
Is there anything else you want to add before we conclude the discussion?
Well, first I want to thank you very much for the opportunity to speak. The healthcare IT segment has frankly had mixed results in the past year or two, post the pandemic, somewhat of a hangover effect. But we believe that going forward, that all the challenges are still there and the catalysts and the tailwinds, so that we believe that it's going to be continually more implementation of healthcare technology, which should hopefully make 25 a good year.
Alan, if the listeners want to reach out to you, how can they do so?
Of course. My email is my first initial and last name, Aklee at maximgrp.com.
Thank you, Alan, for your time today. This was very informative. And thank you for everyone for watching. We have additional presentations and fireside chats coming up next, so don't go anywhere yet. Thank you and have a great rest of your day.